2. Hello, good afternoon. Today we're going to explain our survival analysis of the analysis of patients with diabetic retinopathy. Situation: 187 patients with high-risk diabetic retinopathy were analyzed. Each patient had one eye randomized to laser treatment and the other eye received no treatment. Diabetic retinopathy is an eye disease caused by diabetes where damage of new abnormal blood vessels can cause vision loss, as we see in the picture in the presentation. For each eye, the event of interest was time from start of treatment to the moment when visual acuity fell below 5 to 202 visits in a row. The censorship was caused by death abandon of the end of the study.
We have 4 objectives. The first one is analyze through the use of statistical tools the selected database. Then we have define if there is any association or dependency between some of the variables. The third one is define whether the distribution of the data is normal type or not. And the last one is interpret the baseline data and variables in order to determine which variables have the best effects in the treatment or diabetic retinopathy.
Okay, we have the following results. Show the initial part of the database in our software. We have 9 variables that we can see in this presentation. Okay, the analysis will start by checking is there a normality for the future time until the loss of vision or the last follow-up, taking into account all the data in the database. We have the histogram and we have the future time in months and frequency. The normalities. The null hypothesis is the data of the future time variable are from a normal distribution, but the alternative hypothesis is the data of the future time variable don't come from a normal distribution. In the Kolmogorov-Smirnov test, we have the p-value, and then is less for the alpha value, that is 0.05, and it indicates that each 0 is rejected, indicating that the data of the future time variable doesn't come from a normal distribution. This can be confirmed by the histogram that doesn't show signs of normal distribution.
Here we can see a quantity table of the type of diabetes where the variables are young adult, the diagnosis before the age of 20 years, and if the patient dropped out of any reason external to the study, is count as 0 or lost the size of the eye as 1. The sum of each type of diabetes juvenile adult is 228 juvenile eyes and 166 adult eyes. Obtaining a probability analysis with the condition table, it can be observed that the probability of patients dropping out of the study due to an external cause is higher regardless of the type of diabetes.
For the independent test, we use the chi-square test. The null hypothesis are the variables type of diabetes and status are independent, and the alternative hypothesis is the variables type of diabetes and status are not independent. We obtain a p-value of 0.6466 that is higher than alpha, that is 0.05. This indicates that the null hypothesis is not rejected, indicating that the data of variables, diabetes type, and status are independent. Now for a better analysis of the results, we will separate only the patients who finished the study losing the sight of one or both eyes. It can be treated or not. This in order to exclude from the analysis those patients who left the study for an external cause. In the following histogram, we check if there is normality of the future time to lose of vision or the last follow-up with patients who lose their sight completing the study. Graphically, it doesn't show normality. Now that we are working with data, that focus on patients who lose their sight during the study, we will take into account for a contingency table for eyes with or without treatment and the type of diabetes, juvenile or adult.
In this contingent table, the sum of each type of diabetes, young or adult, is 88, 87 young eyes and 68 adult eyes. These are the eyes that lost their sight after completing the study. Looking at the probabilities obtained with the contingent table, it can be seen that the treatment is effective and it having fewer patients who lost their sight regardless of the type of diabetes.
Test of independence, null hypothesis, the variables type of diabetes and whether it was treated are independent. Alternative hypothesis, the variables type of diabetes and whether it was treated are not independent. With a percent chi-square test by the p-value with 0.0778 greater than 0.05, it indicates that the null hypothesis is not rejected, indicating that the data of variables diabetes type and treatment are independent. To finalize the analysis, a Gaussian kernel plot of the future time to loss of vision in one or both eyes was created, comparing the two types of diabetes, juvenile and adult. And also with a Kruskal-Wallis test with null hypothesis, the medians between the diabetes type groups are equal, or alternative hypothesis, the medians between the diabetes types groups are not equal. With a Kruskal-Wallis rank sum test by means of the graph and the Kruskal-Wallis test, it can be said that by the value p 0.4478 greater than 0.05, a null hypothesis is not rejected, so the medians between the diabetes type groups are equal.
Conclusion. With the analysis sessions and health researchers can be better guide the treatments applied for the diabetes condition. In addition to being aware how it interacts with different groups of patients. Statistical analysis in the different and very extensive range of medicine are essential to be able to continue evolving in favor of humanity, to continue testing innovative procedures, as well as safety and effectiveness in the patients where they are carried out, are the daily task of analysis to have the treatment extremely important information seriously. Perhaps as statistical industrial engineers, we have the common idea of working only in manufacturing of quality areas, without taking into account branches like this, where the contribution and knowledge of this is also important. Thank you for your attention.